All right, Councilmember Mark Squilla, thank you so much for being with us.
Thank you, Larry, and Denise, thanks for having me.
So, you put up a resolution a couple weeks ago I thought was really interesting and really important, forming an opioid task force, and this is going to be funded by money from the National Opioid Settlement. So I had some questions for you about this because I just think it's important and really interesting. So first, can you tell us a little bit about how the task force is going to be formed and what you're kind of looking for here?
The goal initially of the task force was that we're getting a lot of money coming in from the settlement, and it's going to be over 18 years, I think $170 million. And the first year is supposed to be $23 million that we have received or have received partial amounts of that money. So my main concern, and we're working with some of my colleagues, is where are this money being spent? How is it being spent? Who's deciding where that money goes? And so this task force is basically like an oversight committee of the dollars that are being received by the city and making sure that there's input from the community, from council, from the administration, and not just one or two people deciding where this money goes. Now, the first year money that we have already has already been earmarked for certain parts of Kensington, certain programs that they're looking to do. But I think once we saw that, we said, all right, well, there needs to be more input from people who are affected by addiction, residents who live in communities that are impacted by addiction, right? Council members, administration, people who are involved in mental health, people who are involved in addiction services. And I think the input, if it's a general input of people from different walks of life who are all dealing with this, that we will have a better understanding of how that money can be spent, the areas to be spent, and really we want to measure outcomes also. So it's not only about where the money goes, but is the money going in places that benefit both the people who are in addiction and also benefit the surrounding communities that are impacted by people in their communities that are in addiction. And so that was the impetus around creating this oversight committee. And right now the committee is going to be made up of 15 people. We're going to downgrade it to 9, but it was a lot of interest in being a part of this. It's going to be 6 people appointed by council, 6 people appointed by the administration, and then 3 community liaisons. And we thought that we would get together, work with the administration, and then see each year we're going to get money that's going to be earmarked for this cause. And how that money is being spent is so important to seeing if we could address the opioid epidemic. And listen, our overdose rates have been continuing to increase over 1,000 a year. We need to get that number down, but we also need to help the surrounding communities that are really negatively impacted by the opioid epidemic and the people who are unhoused because of the opioid epidemic.
So how are you going to choose the members for the task force?
Well, we're asking the administration to select 6, and we're hoping that they come from the administration comes from different backgrounds as far as do you have somebody from the health department as part of that? You have somebody from homeless services as part of that, and we'll let them pick. And then the council ourselves are going to have 6 folks, and then we're also going to select people involved in the community. Now we are going to then appoint them to this committee of 15. There's some members have reached out already and given us some names. We're going to get a bunch of names. We're going to ask for a call of names. We're going to go over those names and then come up with a short list of, like I said, the administration will have 6. We'll have 6 and 3, which will be 9 from the community. We'll put them together, and we're hoping by the new year, mid-January, we'll have our first meeting. And then the way the resolution is written is that we will be getting 6-month intervals of where the current money's being spent, how it's being used, and then trying to measure those results, and then where should future monies go that we receive, and then also be able to measure that. My big thing is a lot of times we have resources and dollars that we disperse, but there's really no real way to measure the outcomes, right? Like this money being spent here is really doing a good job. We're seeing that the reduction in use here, we see that more people are getting help and services by doing this program. I think we need to really come up with a matrix. We don't have that right now, But my goal is to come up with a matrix from this oversight committee that we could then see, we could actually measure the results of the money they're receiving from the settlement.
And do you imagine the funds going towards government programs, or is it also maybe private organizations doing work in the community, a mix?
It's a mix. It's going, my goal is a mix. Right now, the initial money that the administration has set forth, there's money for like housing repairs for people who are living in those communities that are impacted by opioids. There's money for some of the, what we call our nonprofits, our partners out there that are dealing specifically with addiction, money dealing with community groups. In other words, friends of playgrounds that create programming in these hard hit communities so that people either in addiction or a part of addiction, but also people in the community can have safe havens and safe places to go. So it's going to be both. Again, a lot of it is going to be decided by the oversight committee, and I don't want to put all my ideas out there and think that I'm going to control that, because what we're trying to get away from is one or two people from just controlling how that money should be spent, and have more of a committee assigning the spends, and then also be able to measure it.
Okay, well, it's really interesting, and it's something we're definitely going to keep an eye on. Now, switching a little bit, you are now the chairman of the finance committee, which is one of the clearly the most important committees on city council, because it deals with the money, which is how everything operates. You can't have government without the money. So just very, very generally, what are some of your goals for the finance committee going into the spring?
I mean, every year the budget is so important, and this year I think it's going to be even more important. We have additional resources that we haven't had in the past. We have income that is over budgeted from previous years. So we now see an opportunity, what we can do to move the city in the right direction. And I think this budget is critical in doing that. Also, we have some priorities. I know I have some priorities just myself. We have a couple firehouse stations that are short an engine and a ladder. We have some facilities that need to be rehabbed. We have to take care of our own house. The city is great at building things. We're not great at maintaining things. We have to really look at how we as a city look at all our facilities. And, when we talk about the school district budget, so forth and so on, we know what the facilities committee does and looking at how they address their needs. We have a lot of old buildings in the city of Philadelphia. Rebuild has been great to go through and redo a lot of our rec centers. But if we maintain them, we would never have to redo them, right? We wouldn't have to rebuild them. So my goal in this budget is actually looking at maintenance. Can we really allot resources for capital dollars so that we can maintain our facilities, to keep them up and running? So what they look like now, they'll also be running just as efficiently 10 years from now. And I think that's the key. We have a lot of resources that would go to public safety. Public safety is our number one issue and concern right now in the city of Philadelphia. Every meeting we go to, that's all people talk about. How are we engaging people? We spend a lot of money, $180 million we went to prevention programs, right? Into all these nonprofits, grants, and so forth and so on. How are we, again, measuring those dollars that we're spending for prevention? Are they really doing the job that we expect them to do, right? We have diversionary programs, something like AMP-Court, alternative misdemeanor program, where we have resources that allows people to then have diversion if they do get in trouble, and have opportunities to hopefully not recidivize and then go back and do the same thing again. And then there's going to be dollars for enforcement. So to me, it's a three-pronged approach on public safety. We have to do all three. We can't just do one or the other. We can't have all enforcement and no prevention or diversion. We can't have just all prevention and no diversion and enforcement. So those dollars, I think, are going to have to be looked at very carefully. But again, I think the goal right now with our finance committee is even look back at our past budget and see that the dollars that were spent, were they spent to the outcomes that we expected? And if we do a little bit of that in the beginning, the mayor should give he's been late the last couple of years, but it's usually in March, right? Because it gives us some time to have some meetings. The last couple of years, it's been a very rushed budgeted season, because we're getting them end of April, and then May. And so you don't have time to go over all the line items that are in a budget. The budget's, $5 billion budget. It's a gigantic budget. So hopefully this year it'll be in March, and we're going to push for that. And then we'll have enough time to go over these to make sure we don't only look at our new budgetary needs, but if our old budgetary needs were being met and the outcomes are what we expected.
Well, you said two things that I think are really, really interesting here and important. The maintenance piece. I don't know that I've ever heard anybody really address that in that way, which I think that's really important. And then, looking at past budgets to make sure everything was where it needed to be. And so that's really interesting to hear. And I'll be really interested to talk to you more about that. We're not finished the fall session yet. There's still one more meeting. But while we have you here, are there some things that really stuck out about this session to you that you thought were really important?
Yeah, the council has been very engaged in how we address affordable housing. There was a big press conference yesterday, the start of 1,000 homes and the first-time home buyers program. We talk about affordability in the sense that it's very diverse, like affordability for people who have very low income, but affordability is also for people who work and make $30,000, $40,000 a year. Can they afford still to live in the city of Philadelphia? I think we have to make that a priority, right? We have to make sure that those people that are working and making a salary, even working for the city of Philadelphia, you could be a police officer, a teacher, a sanitation worker. You should be able to buy a home in the city of Philadelphia. So I think the first-time home buyers program, which we emphasized and put money in through the Housing Trust Fund, turnkey, is going to have 1,000 homes that are able to be built now by some of them by private developers, where we have a 5149 program through the land bank, where they're able to build 51% of the houses affordable, 49% market rate to subsidize that affordable housing, but also we're able to buy that down through our turn the key program. So if the house is selling for $230,000 or $250,000, you could then buy it down through a second mortgage from the Housing Trust Fund, and therefore your mortgage may be $170,000, right? So somebody making $35,000, $40,000 could get a mortgage for that, and therefore own a home and then build equity. And if what we're doing is, if you look at it, if you build your equity, you could then have wealth, right? Institutional wealth, where you could then pass it down to your family, and you're getting people to be stakeholders in communities. And I think this is key. Affordability is so important. We talked about public safety. Council has really put their money where their mouth is on public safety. Also, we have pushed for public safety ambassadors, which is a new group of folks that are going to be working under the managing director's office to take some of the non-essential police duties off of them, to have help with these individuals. They're not going to be carrying weapons, and they're going to be just there to assist and do things so that the police could then concentrate on what they do, which is fighting crime. That is, to me, a big deal. This is new for us. Places like New York already have people like that. So we'll have to see how this meshes. We also believe that this, could be maybe an avenue to recruit more police officers, people who want to eventually get into police law enforcement. So also working with the Defenders Association and the District Attorney's Office. We talked about AMP Court earlier. That's a big thing, because we believe diversion is a really important part of public safety, and making sure people who get caught up in the criminal justice system have a way to get out of it. And again, the money we spend on diversion. Diversion is, to me, the best way to deal with crime is to prevent it, right? Let's not get people in that, show people that what opportunities are there for them. What can we do? We have a curfew law, and some people are for and against it, but part of the curfew law was creating resource centers, places for people to go. Youth have a place to go where they could spend time. You don't have to, curfew center or the resource center isn't just for people who are out too late past curfew and get brought there instead of being brought home. That's about giving people opportunities and places to go where they could be safe havens. Our gun violence has been, last several years, has been probably second to none in the city of Philadelphia. So that's been a major challenge. And they are the things that council has focused on this year, and have been really important aspects. And you're starting to see it. Again, when you do things, it takes a little bit of time to start to show the results, right? But we're starting to see the results now. Yesterday's press conference on affordable housing was just the start of 25 homes of 1,000, right? We'll never have enough of it, but we're going in the right direction. And I really believe when we're looking at some of the reports that we saw from Center City District, where some of our retailers are now opening back up from the pandemic. Pre-pandemic, we had 87% occupancy. We're now back up to 80%. We were down as low as 50%. So you start to see the increase of people coming back. Our pedestrian counts are up close to pre-pandemic times in Center City. That means more people around, more people means it's safer. We also see that the opportunities we have, if we really get a handle on public safety and making sure people feel safe, those numbers will increase. If we don't, we believe those numbers will then turn to go down. So, you know, we're at a point right now where it's really important that we continue to go in a positive step. I see the light at the end of the tunnel, and I really see we're going in the positive direction. So I'm really excited about next year, knowing that some of the things we put in place this year have gave us the opportunity to continue that path so that next year we could even surpass where we are now.
And I'd like to bring Denise Murray here on Philip.
Hi, Councilman. Thank you for taking the time to join us today.
Thank you, Denise. Always a pleasure.
Well, thank you. You were talking about diversion as part of the program you want to put together in terms of the opioid task force. Diversion means different things to different people. What does it mean in this context?
Well, we have two forms of diversion right now that are being piloted. One is the police assistant diversion, which is up in Kensington, where the police officers can pick somebody up, say for illicit drug use, right, or using drugs in the highway, retail theft, prostitution. Bring them over to, we have a facility, FL Allegheny, and then warm handoff them to social services. So there's no charges, there's nothing filed, it's just a warm handoff. The social services then engage that individual, give them the opportunity, what opportunities are available to them. If it's MAT, medical assistance treatment, right? Is it rehab? Is it as far as people with retail theft? Is it, can you go to a class? Is there community service, right? These are the options there. At the end of PAD, there's supposed to be, if they don't take any of those options, then there's a processing point. We're not really doing that in that program right now. If they don't want any of those services, they end up just going back out to where they were before, which is a little bit of a challenge, and we might have to tweak that. The AMP court, alternative misdemeanor program, is a little different. That is where an arrest is made. The district attorney gets the record of the arrest, then diverts that person to the AMP court. He then diverts it to AMP court, the DA, the court administrators there. All the services are there also at AMP court. So any service provider that we need, DHS, Health and Human Services, rehab, MAT, everything that you could think of would be there. Even some opportunities for what we used to do with the Dawn Court for people in sex trafficking, to be able to give them opportunities to get out of that. Now that there is, you have an opportunity to take some of those programs. Those programs would then be monitored by the court. Now, if you complete the programs, there are no charges. If you don't complete the programs, then you will be processed and charged with a crime. So there's two different types of what we're doing now. And I guess as we pilot these, see which ones have the best outcomes. The AMP court is only 2 days a week right now. It just started in the end of August, early September. So it's supposed to be 5 days a week by the end of the year, starting in a new year. And so I think we'll start to get some data from that to see how they're progressing as far as diverting people who are committing these offenses to hopefully not commit them again, and hopefully get them the opportunity and resources they need so they could get the help and not be part of, you know, the criminal justice system.
So when we talk about diversion, you have some folks who think that having a safe injection site would be a part of diversion. Is that something that's being talked about as part of the task force, or is that a non-starter?
Well, I think everything's on the table. Everything has to be spoken about. Safe injection site is more of a harm reduction model. I'm not sure it's a diversionary model, because what it actually does is allows people to continue using safely, but not diverting them to much help. You know, I went and visited safe injection sites up in Toronto and was actually very much in favor of them until I went there. You know, we saw a lot of asked a lot of questions, talked to a lot of the neighbors and communities around these safe injection sites. But I think they should be part of the conversation. I don't want to throw my opinion into that conversation, because I know I talk to people who live in the communities, and you know, if these facilities are up and running, but the policies are not in place to protect the surrounding communities where these facilities are in, I, as a representative and elected official, need to represent both the people in addiction, and I also represent the people who live in those neighborhoods. So I have a different feeling on how this is going to be addressed and how it affects the people who live there also. Some people, and I talk to a lot of advocates, say, well, it doesn't matter where the people live. Our goal is just to help the people in addiction. And if those people are negatively impacted, oh, well, you know, that's life. I can't think that way, right? I need to make sure that I evenly listening to the people who live in those communities that are impacted, and trying to help the people in addiction. So the task force and the oversight board will look at these things and see, you know, what the best outcome. And I'm not going to say I agree with everything that they do, right? I'm not there in charge of them and say, you have to do this. That's the whole part of having this committee and this oversight. So it's not just one or two people deciding how the resources are spent.
How do you know how much you're going to have to work with? What, I guess, what level of resources?
Well, we know this year supposedly $23 million. Now, so from talking to the administration, they received some of that money and not all of it. And some folks said, yeah, we have received all of it. So we don't know. Part of this committee's challenge will be to make sure we stay on top of that and where that money is. Secondly, is every year, I think, is a different amount, right? 18 years, $170 million, how that goes. I mean, this money is not enough money to solve our city's problems. It's just enough to get us with, I think, the resources necessary to point us in the right direction. And then the city's going to have to complement those dollars by spending other money, you know, whether it's health and human services and our nonprofit partners, to make sure we're addressing the needs on the street. But I think that having the people's eyes on that, concentrating just on the opioid settlement dollars. When we're trying to do it, we're busy doing 20 different things at a time and not really concentrating. Our whole focus is not just on one thing. This oversight committee's focus will be just on that one thing, coming up with recommendations, and then measuring the outcomes of the money being spent. To me, that's the key also of the oversight committee.
Okay, I have one more question, and it's about council itself. Basically, over the last few months, council has done like a kind of a remix where a bunch of your colleagues have decided that they're going to run for mayor. So they've left the body and they've been replaced by new people. You all are still one short because they still haven't had a special election to fill Helen Gim's seat yet, but the seats of like Alan Dom and Derek Green,
Parker, Maria,
all of those folks that have been filled in. Has council gotten a different vibe from this new group of people? Is it still pretty much the same working kind of environment? And how have you adjusted to that?
Yeah, I mean, council is a very cohesive body. Not everybody on council thinks the same way, which is great. You need diverse minds on council. You need people to think differently because they challenge each other. They tell you why, they educate each other. They show you concerns from their constituencies. You have district council members that are really in tune with their district, right? It's not citywide. It's just with the challenges in our district. There's 10 of them, right? Then we have 7 at large that deal with city issues, right? And we listen to those folks. We have people who are interested in business development, increasing our business income. We have people interested in just social service issues, right? We had everybody had their own little piece, but you put that all together, you get a very effective body that really reaches a lot of different things and really works well together. Again, not saying that everybody agrees, but we all respect each other. We all talk to each other. We all are friendly with each other, and we vote against each other's issues. We vote for each other's issues, but we had a really good rapport. Now, when you bring new people into that mix, and listen, we had some great colleagues leave, right? Sherelle Parker, Helen Gim, Maria Sanchez, Alan Dom, Derek Green, and I'm hearing possibly David O. So, I mean, we might end up with 2 open seats. It couldn't be more diverse people who have left, right, with different ideologies. But bringing new people in, we have to learn what their positions are, right? And then we also have to help them, though, bringing new people in and guide them on, how does council work? What is the best way to get things done? How do you build the majority? How do you get to 9 votes? The people who have came in, and I got to say, they have been great. And I mean, Sharon's been around forever. Sharon Vaughn, right? Jim Harity, people know him throughout, and he was very associated with Senator Street. And then you have Anthony Phillips, who was up in the Northwest with Sherelle Parker. And you have Ketzi, who worked in the 7th District for Maria Sanchez, Lozada. And so she has a little familiarity with the council and how the council works. So, everybody does bring their own little personality, and you got to find your own niche. So it's going to take a little bit of time, right? And so, the only problem with this time compared to when you first come in, like when I came in, we had 6 new members when I came in. And so, but we all came at the same time, and you had 4 years to work on it. Unfortunately, the people who are just coming in now run again in May, right? So they have to run and win. And so the challenge is now you're focusing on a campaign, right, while you're on council. And so I think you're going to see probably maybe a little bit less things being done. This is my idea in the session after January, from January to June. But to me, this is an important session. We got to get everybody up to speed on the budget. This budget is going to be critical. And I think if we don't concentrate on any additional legislation, one thing we got to get right is our budget. And I think we're going to try to work with our council leadership and Council President Clark to make sure we get people on board and aligned with what our budget priorities are as a council, not an individual. Every individual will have different priorities as far as our budget is concerned, but as a council, what are our global priorities, and make sure we meet them so that when people do run and whoever wins in May and comes in January has a really solid budget to work with so they could push for their agenda.
Okay, well, thank you, Councilman. We really appreciate it. And I'll turn you back over to Larry McGlynn, our co-host here on Hall Monitor, and you're listening to Hall Monitor on WPPM 106.5.
Thank you, Denise. Councilmember, thank you so much for joining us.
My pleasure. I have to say, I really enjoyed conversation with the both of you, and thank you for doing this, and making sure people understand and hearing what's going on there, and always also let them know they can always reach out with concerns and whatever it is. Reach out to your council members. They work for you. We're here for your concerns, and that just having the voice and making sure you're sharing that message is so important, so people know that. And I like to wish everybody a happy holiday season, happy, healthy, and prosperous.
You too, Councilman. Thank you so much.
All right. Have a great day.